indistinguishable from pain from other diseases like angina or heart disease. Regurgitation, another very common symptom. This is the perception in the oral cavity of reflux stomach contents. It could be bitter, it could be an acidic taste. I've had patients even tell me that they would wake at night and see that their pillowcase had bile staining on it, meaning that they regurgitated when they're asleep. Water brash, just to distinguish the two, water brash is a very old term, but water brash is the spontaneous appearance of fluid in the mouth. It's usually a result of stimulated saliva. It's a body's defense mechanism. But patients, again, will tell me sometimes, I wake up at night and my mouth's full of fluid. Well, that's the body's defense, secreting the fluid to wash things down and try to clear the acid out. Other symptoms, nausea, vomiting. This is usually irritative and their response is variable. Some people get a lot of it, some people don't. And I want to go over two other symptoms, and these are words you're going to probably hear for the first time, but they're very important. One symptom is dysphagia. Dysphagia is a sense of the food or fluid being stuck or not moving as it traverses the esophagus. Food gets stuck. It's an important symptom because it may imply more than reflux disease. It may imply something else going on. Either a stricture, closure of the esophagus, the muscle's not working right, or something growing in the esophagus, or a ring, or an ingrowth of the lining. There are a variety of things, but it's a symptom that we take very seriously and we work up very seriously. And odynophagia. So dysphagia is the food getting stuck. Odynophagia is pain on swallowing. You swallow, as the food is traversing the esophagus, it causes pain. Now the food generally only takes about 10 seconds to get from here to the stomach. So that's the time in which you're going to start feeling that. Oftentimes, odynophagia is from other injury to the esophagus. It could be from a pill that got stuck and caused an ulcer, very common scenario. It could be from erosive esophagitis from acid disease. It could be from even an infection in the esophagus. These are a little bit more common to see odynophagia in non-acid-induced injury. There are extraesophageal symptoms. This is a big topic recently. What else does G.R.D do? What else does it affect other than just causing heartburn and chest pain, etc.? Well, it does a lot. It can cause sore throats. It can cause hoarseness on awaking in the morning, earaches. There's a symptom called globus hystericus where people feel like suddenly there's a lump in their throat. Very common symptom. Coughing, wheezing, shortness of breath. Asthmatic symptoms, not uncommon. Halitosis, or bad breath. And it can cause, indirectly, it's not really reflux related, but symptoms we call gas bloat. That usually implies another problem in addition to GERD, but it's a sense of just pressure in the chest or in the upper abdomen. Let's go over some of the complications of gastroesophageal reflux disease. We mentioned one, I'm going to re-mention. It's an important complication, and that's erosive esophagitis. That's erosive esophagitis under the endoscope. It's nasty looking. It's a breakdown in the lining of the esophagus, and it can be from acid reflux or reflux of any contents of the stomach. It can be related to pills that cause a caustic reaction in the esophagus. It could be from caustic ingestion, usually in children. They drink something they're not supposed to. And it could be from an infection. It could be from yeast. It could be from a viral infection. We're going to apply it this evening to acid reflux disease. But as you can see here, that lining is supposed to look a nice, even salmon pink color. And what you're seeing is extensive ulceration, and the redness, the ulceration is white, and the redness around it is very raw tissue. And this is what it looks like and you can imagine that hurts. Esophageal stricture. Let me see, I think I have a... I wanted to bring this up before I got the stricture. This is a very important slide. I'm sorry if these slides are a little... These are slides I use for another talk that I give physicians, so I tried to pick appropriate slides for this talk. What I wanted to bring up is that the incidence of heartburn and regurgitation, the severity of the symptoms, do not really relate to the degree of esophagitis. And this bothers me. I like patients that come to me that have heartburn when they have injury, because I know how to gauge their injury without endoscoping them every year. Some patients come to you and don't have a lot of symptoms. Some patients come to you and are just hemorrhaging, and you find very severe esophagitis, and they really didn't complain of much. And there's not a very good correlation sometimes. And that's distressing for the physician because we like correlation. We like to gauge that. We like to step up or step down our therapy based on what we think the activity of disease is. Very important. Okay, our next complication I want to discuss is esophageal stricture. Esophageal stricture is a response to injury. It's scarring and closure of the esophagus as a result of inflammation and healing. We all know that when you cut yourself or you injure yourself and it heals, the scar tends to shrink. If you injure the esophagus and it heals, the esophagus tends to scar down and shrink, and it will create a narrowing, and it looks like the neck of an hourglass. And that can impair the food to get through. It's a very stiff portion of the esophagus now because it is all scarred down.